Johnny, you need to quit drinking.
I love that Vanna White. She can turn my letters anytime.
You need to quit drinking.
Why?
The doctor said that liver cirrhosis has a lot of complications. It could kill you.
Scoliosis of the liver? That doctor doesn't know nothing. My old man drank till he was...
Have you looked in the mirror lately? You're turning yellow.
Don't judge me!
It's not judgment.
When I was throwing up blood the other day, where were you?
I was at work. Maybe you should get a job and stop drinking.
It's not easy being unemployed, you know. It's not all glamour and stuff. I'm empty. I don't know where all you dogs came from, but somebody's been drinking an awful lot of alcohol around here, and I think it's you. Loretta!
My name's not Loretta.
Loretta, get these damn dogs out of here.
It's only one dog.
Where'd all the cats come from?
We don't have any cats. You're acting funny. John, you've been up all night. You don't ever sleep anymore.
Don't judge me.
You're scaring me.
I found it.
John, I'm calling 911.
Tell him I said I.
So knowing the patient has cirrhosis of the liver, what abnormal signs and symptoms did you notice the patient exhibiting?
He's acting funny. He has these weird floppy arm movements. He's not sleeping. He's up all night. He's drinking even more than 6 months ago. He drinks a fifth of Seagram 7 a day.
Okay, well, since he's still drinking, we had already diagnosed him with the cirrhosis. The drinking has probably aggravated things, so the next step is for us to run some tests. So that's what we're going to set you up for, okay?
Whatever you say, Doc. Not having the rectal exam, though.
What tests do you anticipate being ordered, and what medical diagnosis would you consider?
So what are these tests you think you're going to run?
Well, we're going to do a head CT to check for bleeding. We're going to do a CBC to rule out any kind of infection. We're going to do a metabolic profile to check your electrolytes, like sodium, potassium. We're also going to do a liver function test, and we're also going to check your ammonia levels, which are really important to look at to rule out hepatic encephalopathy. So that's what we're going to do. The nurse is going to come in and get some blood drawn.
Great.
All right.
Thank you, Doctor.
You're welcome.
So, Miss Winchester, I'm just going to get some supplies and we're going to go ahead and draw that blood and start an IV, okay?
Yeah, baby.
Well, John, your test results have come back. The head CT was clear, so that was good. But your liver function test, all your liver enzymes were elevated. Your AST, your ALT, your bilirubin. And then your ammonia level was sky high. It was 95, which is a critical high value. So based on your history, what your wife has described as far as the symptoms that you were having at home, I think we can go ahead and confirm a diagnosis of the hepatic encephalopathy. Okay?
So, Mr. Winchester, how are you doing?
Well, you know.
We're okay, but the doctor just said that he had hepatic encephalopathy.
Okay.
We don't know what that is, though.
Well, it's a potentially life-threatening complication from your damaged liver. And because he already has damaged liver, it's not excreting the toxins that are building up. So therefore, it's building up in his blood and going to his brain and damaging his brain cells. It's a good thing that you went ahead and brought him in because it's very treatable in the early stages.
What interventions would you implement at this point?
Great, so now what?
Well, the first and most important thing that we need to do is we need to keep you safe. Because of your confusion, you have a high risk for falls and injuring yourself. Secondly, I'm going to give you some lactulose. It's going to help decrease the ammonia levels in your body. It will give you loose stool, so make sure you call me when you need to get up and use the restroom.
Great.
Also, I'm going to hang some antibiotics, and it's going to help decrease the bacteria in your intestines that produce ammonia. That's also going to help decrease your ammonia levels.
Can I still keep drinking?
No, that is the worst thing that you can do, is you need to stop drinking because it can lead to another onset of this or more complications like bleeding. We're going to watch you for a couple days in the hospital and hopefully the doctor will let you go home soon.
Oh, babies, I'm happy to be home to you. That damn lactulose that they gave me at Pender Memorial, I'm glad to be out of that damn Band-Aid station.
John, the doctor said you shouldn't drink anymore.
He don't know nothing about no hell elephant pancreatopathy
There
or
was hepatic encephalopathy.
esophageal variables or nothing like that. He's a quack.
What am I going to do with you?
I got an idea, baby. Well, if I get bad again, like when you called the ambulance, then maybe I'll thinking about something.
Oh my God, John, are you okay?
Buddy!
Oh God, this is
The
bad.
dog pissed on me.
Oh John, I'm going to call 911.
Oh, my stomach!
What complication of cirrhosis is he experiencing?
John, you're a pretty lucky man. The bleeding that you had is fatal about 30% of the time. Esophageal varices are a pretty serious complication of your ongoing liver problems. You have a lot of bleeding with them. Really what happens is that your liver has become scarred. That scar tissue prevents the proper flow of blood through the main vessels and veins in the liver. That causes pressure to form in a vein called the hepatic portal vein. And that pressure in turn causes the smaller vessels in your esophagus and in your stomach to be very prone to rupture, which causes a lot of the bleeding. So what we're going to do is we're going to monitor you for a little while, okay?
What interventions would you expect for esophageal varices?
John, this is serious. You almost died. You have to quit drinking.
I'll do it for you, honey.
Mr. Winchester, how are you feeling today?
Am I cured? Can I go home? What's going on?
Well, what they did is they took an endoscope and they put rubber bands around the bleed in your esophagus. You bled out a lot. You could have died. The doctor did put you on a beta blocker, which is a blood pressure medication. It helps reduce the pressure in your portal vein. The biggest thing, John, is you really got to stop drinking. Liver cirrhosis is the #1 cause of esophageal varices. And since you already had it, you have the higher risk of getting it again.
Son of a Budweiser.
Hey John, I'm home. How you doing? Did you meet with your sponsor today? John? Oh my God, John! John! Oh my God!
Yeah.
My milkshake brings my voice to the young and they're like, it's better than you, damn right, it's better than you. You look like hell. What's so funny?
Okay. Film me.
Ready?
Oh, man.
Is that good?
Alright. Ready? And Mama more.
You should have switched back to mayonnaise.
Jaeger shot. Did you know?
Okay. I'm gonna have to buy her another bottle of ketchup after this year.
That's alright, I'm willing to do that.
The woman's not made of money.
You are made of ketchup though.
That pressure causes smaller vessels in your esophagus and in the stomach to rupture.
You did put you on some blood pressure medications, which is considered a beta blocker. What is it? They...